Leaving your corporate job to go solo is a massive win until you become your own HR department. If you're stressed out about getting health insurance, here's the 6-step roadmap to getting covered from scratch so you can stop worrying about what ifs and get back to building your business. Step 1 is the benefit exit strategy. Most people think their health insurance vanishes the day they quit, but you often have until the end of the month. Find that exact date and treat it like a deadline. You've already paid for these premiums, so don't leave free healthcare on the table. Refill your prescriptions and get your physicals done now while your company is still footing the bill so you don't have to dip into your business savings for them later. Hi, I'm Shami. I'm a healthcare finance consultant, and I help entrepreneurs and people planning for retirement take control of their healthcare costs when they no longer have an employer's safety net. On this channel, we turn healthcare from your biggest stress into your most manageable expense. To stay insured and informed, hit that subscribe button down below. Step 2 is to run a healthcare audit. Before you even look at a single plan, you need to separate your must-haves from your nice-to-haves. List every doctor, hospital, and medication you use right now. Then ask the hard questions. Who is a non-negotiable? If keeping your specialist means paying $200 more a month in premiums, is it still worth it? I've switched dermatologists to save money when I was transitioning from my parents' plan to my job's plan and found someone I liked just as much. But if you have a chronic condition, that doctor might be worth the extra cost. Decide your deal breakers now so you don't get analysis paralysis once you're looking at 20 different plan options. Step 3 is identify your open doors. Health insurance isn't just something you can buy whenever you want. You need a key to get in, so to speak. And for you, that key is your qualifying life event, aka leaving your job. Right now, you have 4 main doors open: the ACA marketplace, COBRA, a spouse's plan, or private insurance. If your income is currently low, Medicaid is also on the table. Your goal here isn't to pick a plan yet, it's to mark your expiration dates on the calendar. Missing one of these deadlines could leave you without coverage for months or force you into a less attractive option. Map your options out and their deadlines now so you don't accidentally lock yourself out of coverage. Step 4 is to forecast your cash flow. Since you don't have a predictable salary anymore, you need to know your numbers to see which insurance subsidies you actually qualify for in the marketplace. Don't aim for perfection, aim for a conservative estimate using these 4 metrics. First is your committed income. What's already under contract, and what are your recurrent clients expected to pay? Second are your historical trends. What have you actually made in your side hustle or business over the past few months? Annualize that number, but be sure to adjust for seasonality in case your business naturally makes more money in some months than others. 3 is your survival number. What's the absolute minimum your business and household need to stay afloat? Think rent, food, transportation, debt payments, subscription costs, insurance, etc. And 4 is your runway. How many months of savings do you have if you don't have enough revenue to cover your survival number? The longer your runway, the more flexibility you have. Knowing these numbers does more than just help you pick a plan. It tells you if you qualify for premium tax credits on the marketplace, which can save you hundreds of dollars every month. Determine your conservative estimate now so you can claim every subsidy you're entitled to. I've put a link to a subsidy calculator in the description down below. Plug your conservative estimate in there and see how much of your monthly premium might drop. Step 5 is to set your worst case scenario number. As an entrepreneur, your healthcare budget is more than just a monthly premium, it's a risk management strategy. The question you want to answer in this step is, how much of a financial hit can my business take if I have a major medical event? To find your worst case scenario number, start with your current employer-sponsored plan as a baseline. First, I'd look at what I'm currently paying for health insurance through my payroll deductions. But remember that your company was likely paying a large portion of that cost behind the scenes, about 85% for individuals according to a KFF analysis. Now that you're the boss, you're responsible for that full amount. Then I'd find one of the most important numbers on my current plan, which is my out-of-pocket max. Think of this as your financial safety net. It's the most you'll pay out of pocket for covered services during the year before your insurance starts paying for it all. Now ask yourself this, If I had a major medical event, could my business handle a year where I paid my health insurance premiums and also reach my out-of-pocket max? For example, let's say $150 comes out of your paycheck every month for your premium. That's $1,800 a year. If your employer was covering around 85% of the cost, your health insurance may have actually cost around $12,000 a year. Now let's say your out-of-pocket max was $5,000. Suddenly, a really bad healthcare year could expose you to around $17,000 of healthcare costs. Keep in mind that this is just some quick and dirty math to help you estimate your potential exposure. The actual amount you'll pay for your health plan can vary based on your age, location, plan type, and many other factors. So the question you want to ask yourself is, could your income estimate from step 4 survive that? If this scenario would wipe out your emergency fund or runway, that's probably not the right plan for you. Knowing the absolute most you're willing to pay in a worst-case scenario allows you to choose a plan that protects your business from a medical catastrophe. And last but not least is step 6, which is to execute your selection. Most people start here and get overwhelmed by the sea of premiums and deductibles, but not you. You're not just browsing, you're using a framework to eliminate bad options fast. As you look at plans, run them through these 3 business stress tests. First is the network test. Can you keep your non-negotiable doctors and medications? Use the plan provider directory to verify before you click buy. Second is the cash flow test. Don't just look at the premium. Will the monthly cost plus the cost of your regular appointments and prescriptions actually fit into the survival income you calculated in step 4? And third is the worst case scenario test. Compare the plan's premium and out-of-pocket max to your safety net number from step 5. If a medical emergency would wipe out your business runway, that plan is most likely a no. By using these filters, you aren't just picking a plan, you're securing your business. Once you've narrowed it down to the final 2 or 3 plans, you can make a confident decision and get back to what matters, growing your company. What's the #1 thing that's making you hesitate to leave your corporate job and go solo? Is it the costs, the choices, or the fear of a gap in coverage? Let me know down in the comments below. I'm building more resources for the self-employed community here, and your feedback helps me to build the right tools for you. I'll see you in the next video.